So yeah, we'll start with local anesthetic techniques of the head this morning. So mainly it will be nerve blocks, so the infraorbital, the maxillary, the inferior alveolar or mandibular nerve block, the mental block. We talk about the retrobulbar block as well, which is probably a bit more of an advanced technique, and some topical use as well. I'm a bit unsure who does these nerve blocks in your practice, but there's some restrictions with nerves, but all of these blocks you should technically be able to do and allowed to do because you're not entering a body cavity. So we'll go about this, but I'll talk a little bit more about like what to expect, side effects of these blocks as well, things like that, what might happen when and when not to use them. So the most commonly local anesthetic agents used in veterinary practice are lidocaine and bupivacaine. They're used usually, lidocaine is a 2% solution and the bupivacaine is a 0.5% solution. And the total dose of local anesthetic use should be based on the number of injection sites and the body weight of the patient. So if you have a patient which needs loads of dental extractions, for example, try and plan this ahead, or it's usually, I think, assumingly the extraction will be done by the vet, so that you plan ahead what you try to do in order to calculate the total dose of your local anesthetic and then start the injection, so that you just like plan what you'd like to do, and then you can just like divide it and make sure you're not injecting too much, which can cause some toxicity and adverse effects as well. So the maximum volume should be calculated before. Brilliant, and you can see here, so we usually say for lidocaine the maximum dose should be about 4 milligrams per kilogram, and cats probably a little bit less, sometimes 3. Bupivacaine we usually say 1 milligram per kilogram. In some of the wound catheters we talk a little bit later on, and we probably say 1.5 milligrams per kilogram. The onset of the lidocaine is very quick compared to bupivacaine, so it's 1 to 3 minutes, so that's why we often use lidocaine for the dental blocks, because we don't desperately want to wait a long time, whereas this is slightly different if you do a surgery and you do a block of any limbs until you're actually entering theatre and the surgeon starts the surgery. You probably have the 20 minutes until the block will actually work. This has also, the onset has to do a little bit with penetration time, so the closer you are possibly and you're more embedded you have your nerve, the quicker it might work as well to a degree. The duration of action of the lidocaine is about 1 to 2 hours, whereas the duration of action of the bupivacaine is about 6 to 8 hours. So it varies a little bit. So generally for the head blocks we'll start with lidocaine. That's what I mostly will refer to, but you get dosages for both. In terms of side effects, so toxicity and absorption into the systemic circulation can happen. The most common, or the effects can happen on either the central nervous system or the cardiovascular system. What you might see, and this is generally reported, so there's some things reported from human medicine, so tingling of the lips and slurred speech, obviously we won't desperately see, but this has been reported, and this is something which, like in hospitals, people will be asked to speak, for example, how they feel, but it can happen to a degree. So like in our animals as well, we just like need to just like be aware of it. So tingling of lips might be just like a funny sensation. They might start licking, they may look a bit funny, so that's something as well which you can see. Then further on, for more toxicity effects, if you actually get a central nervous system effects, you can get like a reduced level of consciousness with worst case scenario seizures. Again, that usually will happen if you give a massive overdose, and mainly if you inject it into either a very highly vascularized bed or intravenously. That's why it's really important to always aspirate. I'll always say this. I think it is something which also was kind of drummed into me. You'll always aspirate. I'll tell this to all my colleagues, all the interns and residents. I think it is really important because it's a side effect we can avoid fairly easily. by aspiration. Cardiac side effects might be arrhythmias, often ventricular arrhythmias, but could be other arrhythmias as well, and reduced myocardial contractility, which then will reduce your cardiac outputs and perfusion to the organs. Again, if you have a slight drop in blood pressure, I wouldn't desperately worry that it might be a toxicity. It could be all the other drugs you're using during a general anesthesia, but it's something to look out for. If there's a sudden drop in something, if there's a sudden onset of an arrhythmia that could be related to your local anesthetic, yes, it could be related to you've just injected a needle with the sympathetic stimulus as well. So, but it's something to definitely look out for. That's why ECG monitoring for these cases is quite important as well.